Most of the time, we think of diabetes as a chronic condition, something that's manageable day to day. But what happens when that management fails, or when the body gets hit with some kind of extreme stress? Well, that's when we enter a totally different world, the world of acute complications. These are sudden, super severe events that can turn a chronic condition into a life-threatening emergency fast. So what does that really look like when things spiral out of control? When that delicate dance between sugar and insulin just completely shatters, the body's entire chemistry can go haywire. We're talking in a matter of hours, leading to a full-blown medical crisis.
Okay, so let's get really clear on what we mean here. An acute complication isn't some slow decline. Nope, it is a metabolic crash. It's a sudden, high-stakes emergency where literally every single minute counts. And understanding exactly what's going on under the hood is the absolute first step to saving a life.
To really get to the heart of this, we need to look at the two main ways that diabetes can become critical. Now, they might sound a little similar at first, but as you're about to see, they are fundamentally different problems at their core. And these two big ones are diabetic ketoacidosis, which we'll call DKA, and hyperosmolar hyperglycemic state, or HHS. These are the two most serious acute complications you can get. And while, both involve high blood sugar, they take very, very different paths to get to that dangerous place. All right, so let's do this. Let's break down these two crises, DKA and HHS, and look at them side by side. Because understanding the mechanics of each one is totally key to recognizing the unique danger that each one presents. First up, DKA. This is kind of the classic emergency we often think of with type 1 diabetes. The main problem here is a severe lack of insulin. Without insulin, the body's cells are basically starving for sugar, even though there's plenty of it in the blood. So they're forced to burn fat for energy instead. And this process creates these acidic byproducts called ketones. So picture this. Think of your body as a factory that's run out of its main fuel, which is glucose. In a total panic, it starts burning its own furniture, the body's fat, just to keep the lights on. Well, the smoke from burning that furniture, that's like the ketones. And pretty soon, the whole factory is just filled with this toxic acidic smoke, making the entire system acidic and totally dysfunctional. And this is where you see the body just screaming for help. The nausea and the belly pain, those are classic signs. That rapid, deep breathing, it's called Kussmaul respirations, that's the lungs desperately trying to blow off all that extra acid to fix the pH balance. And that really distinct fruity smell on the breath, that's literally acetone, a type of ketone being exhaled. It's wild. Okay, now let's completely switch gears and talk about HHS. This one is way more common in type 2 diabetes. And here's the difference. There is some insulin around, just enough to stop the body from burning fat and making all those acid ketones. But there isn't nearly enough insulin to handle the sky-high blood sugar levels. So instead of an acid problem, you get this completely different kind of crisis. The blood gets so overloaded with sugar that it literally becomes thick and syrupy, almost like molasses. To try and dilute this thick blood, the body starts pulling massive amounts of water out of its own cells. This leads to profound, life-threatening dehydration, and that's what causes the confusion, the altered consciousness, and even the coma that we see with HHS. Okay, so when you put them side by side like this, the differences just jump right out at you. I mean, look at those numbers. With DKA, the blood sugar is high, but in HHS, it's just astronomically high. We're talking often over 600. And here's the most crucial part, the pH and the ketones. DKA is all about high ketones and acidic blood. HHS, the pH is normal and there are hardly any ketones. It is a completely different metabolic picture. So if you remember one thing from all of this, let it be this right here. DKA is, at its heart, an acid problem, and HHS is a dehydration problem. This one distinction drives absolutely everything, from the symptoms all the way to the emergency treatment plan. So knowing these huge differences, how do medical teams actually respond? Well, the treatment is this very precise, very urgent plan that's aimed at correcting the specific metabolic chaos of each condition. Let's take a look at how they do it. So, the game plan has three main goals, and let me tell you, the order here is everything. First and foremost, fluids. You have to aggressively replace all that lost water with IV saline. This is especially true for HHS. Second, electrolytes. You have to watch potassium like a hawk because it can swing to dangerously low levels during treatment. And then finally, you give the insulin to actually stop the underlying problem. And this right here, This brings us to one of the most critical safety checks in all of emergency medicine. Here's why. Insulin actually drives potassium from the blood into the cells. So if a patient's potassium is already low and you give them insulin right away, their potassium levels could plummet, and that could trigger a fatal cardiac arrhythmia. So the rule is fluids first, check and fix the potassium, then give the insulin. It's a life-saving sequence. Okay, let's pull all this together. We're going to recap the key takeaways, and then we're going to look at one more condition that can actually mimic these emergencies, but has a totally different cause.
So let's just nail this down. The crucial points to remember are: DKA is an acid crisis from fat burning, and it's most common in type 1. HHS is a severe dehydration crisis from syrupy blood, most common in type 2. Both of these are life-threatening, and they're often kicked off by some other stress on the body, like an infection. And the treatment priorities are always fluids, electrolytes, and then insulin.
But wait, there's a clinical curveball. There's another condition that shows up with the exact same acidic blood, ketoacidosis, but it has absolutely nothing to do with diabetes. It's called alcoholic ketoacidosis, or AKA. So what is AKA? It's basically what happens after an alcohol binge leads to someone vomiting and not eating for a while, essentially starvation. That combination of alcohol's effect on the liver plus having no food coming in forces the body to produce ketones for fuel, just like in DKA. And that leads to that same acidic state. And this right here is the single most important clue for doctors. Unlike DKA and HHS, which are defined by high blood sugar, a person with AKA will often have normal or even low blood glucose, and that completely changes the treatment plan. Instead of insulin, the treatment focuses on giving them dextrose, a form of sugar, to shut down that ketone production.
So we'll end on this thought. DKA, HHS, AKA, they're all serious metabolic emergencies, but they require very different approaches. Understanding the signs, from that fruity breath to extreme confusion, and knowing the key differences in their underlying chemistry, well, it isn't just academic. It's knowledge that can and absolutely does save lives.